in the bills, and then I'll tell you how to influence what you would like to see. The odd thing about all of the ire and tension and all of the town halls and subsequent media reports is that mostly the House and the Senate agreed on a lot of things. It is really accurate that more than 95% of the bills that came out of the House and the Senate were in agreement. And they do several key things. One is coverage. Significantly expanding the number of Americans and the number of Missourians who have health care coverage. We now are over 50 million uninsured Americans, nearly 800,000 Missourians who do not have any health coverage. The bills in Congress, whether it's the House or the Senate, would insure more than 30 million Americans who currently have no coverage, and more than 495,000 Missourians who currently have no coverage. That's in both bills. Somewhat different approaches, but it's in both bills. The other thing that's in both bills are very significant changes to our health insurance system in terms of how health insurance companies who offer coverage in the private market for individuals and small businesses have to behave. Those changes are very like the rules that health insurance companies already have to abide by in the employer market. So things like they can't turn you down for coverage because you have a pre-existing condition. Can't charge you more in terms of a monthly premium because you have a pre-existing condition. Can't drop you if you get sick. So that dropping and pre-existing is cherry picking and lemon dropping, they call that, right? It's already that way in the employer system. If, God forbid, I had cancer and I got a new job and it provided health benefits, that health insurer couldn't say, no, we're not going to insure Amy. They have to give us health coverage within the group, the rules of group insurance. So these insurance reforms primarily apply to the individual market and the small group market, and I'm going to talk a little bit more about that. The other changes to the insurance market that are in both bills are caps on what we have to pay, so our out-of-pocket expenses and affordability. So right now, if I purchase coverage in the individual market, I go to an insurance agent, I get a plan, I might have high deductibles and all of that, but there's often a cap. If I got sick, they may only spend this much money per year, this much money for my lifetime. Both of the bills in the House and Senate, they take away the ability to cap it. What gets capped is our out-of-pocket expenses. So it really gives that protection from we lose our houses, we lose our farms, we lose our small businesses if we have a catastrophic illness. That's, again, in both the bills, significant insurance reforms. Another thing that's in both the bills, so this is a third category, I talked about coverage, significant insurance changes, is strengthening Medicare and Medicaid. So we currently have very strong public insurance programs, the Medicare program, which I'll bet a lot of folks have worked with, and some people in this room may even have, and the Medicaid program. I'm going to talk a lot more about that at the very end of my 15 minutes because I know about the changes that are in Medicare and Medicaid. But that's another key thing that's in both plans. And I want to show people a picture. I draw this picture because people are really confused. What's a health insurance exchange? What's a public option? What's this? What's that? So hopefully this will help a little. Bear with me. And I know people won't be able to see, everybody won't be able to see, but so I drew a big square and I wrote inside employer. More than 53% of Americans currently have health insurance. That's sometimes working for them, mostly working for them, pretty good coverage because they get it through their employer or a spouse's employer. So a significant number of us are already covered and already in the system. In addition to that, this is not exactly to scale. I'm drawing two circles underneath. And I'm writing in those circles Medicare and Medicaid. I need a better pen. More than 12% of Americans are currently receiving Medicare. So as many people know, Medicare is the program that provides health insurance for people 65 and older, but not all of them. Almost all of us who are over 65 get Medicare. Some people with disabilities who have been permanently and totally disabled for more than 2 years, and some families and children who are living in poverty. So more than 12% of our country gets health insurance through Medicare. I'm sorry, the people in poverty goes with Medicaid. Medicare is seniors and people with disabilities. And then more than 13% get coverage through Medicaid. And again, that's some seniors who have it as a secondary payer and families living in poverty. And some people with disabilities before they get Medicare, and sometimes as a secondary payer. So all along through all of this, when you heard Congress and the President and people saying, if you like what you have, you can keep it. So if your health insurance is working for you, you're getting what you need, nobody's going to make you do something different. They were mostly talking about this. If you have employer-sponsored coverage, that's not what Congress is changing. Although they hope that the changes they're making will make it more affordable in the marketplace. But they're not changing employer coverage. They're not significantly changing Medicare or Medicaid in terms of people won't lose it. But they are making changes to how those programs are going to work in terms of the cost and effectiveness. So that's what they mean when they say, if you like what the health insurance you have, you will not be forced to change. The thing that Congress is trying to do now that they've never tried to do before that's significant is create what they call a health insurance exchange. Now, many people have been confusing the exchange for something called single payer, or the exchange for something called the public option. That's real confusion. They are not all one thing. But both bills in Congress would create a new marketplace with rules that insurance companies would have to abide by to sell us coverage. But the people who will be in this exchange or benefit from this exchange are primarily people in the individual insurance market and the small group market, not large employers, as well as the millions of uninsured who might be able to and want to go to purchase coverage if it were affordable and if they could get it even though they have pre-existing conditions. So when I say individual market, if you don't have employer coverage or even if you decline your coverage and you have to go to an insurance agent and apply for coverage and they go and tell you, well, Anthem could do this for you and United could do this for you, that's the individual market, and that's the place where the insurance rules generally don't have the same protections. So it's this health insurance exchange where those new rules would go into effect, where insurance companies would be required by federal law that they had to offer plans if they wanted to be here, if you could shop for them. They had to offer plans that would take you even if you have a pre-existing condition. They have to offer plans that would not charge you higher premiums if you're sick. Wouldn't charge you higher premiums if you're a woman. Would only charge you higher premiums by your age, but it's limited. They can't charge you 10 times. They might be able to charge you 2 times more because you're 60 and not 20. So significant rules, those out-of-pocket expenses, that's what Congress is creating. And the idea is that with all of this, where we now have many people losing their health insurance if they get sick and losing their health insurance if they lose their job, we would actually have a guarantee that you could have coverage because of these new rules, even if some of those bad things happen to you, like you lose a job or you get sick. So that's what's actually in the House and Senate bills. Now, the other thing I wanted to back up, because we are talking about caregivers, is both of the bills have significant changes in Medicare and Medicaid